Everyone. Before we begin, can I remind members about the social distancing measures that are in place in the Chamber and across the Holyrood campus. Please take care to observe these over the course of the afternoon's business, including when entering and exiting the Chamber. First item of business today is portfolio questions. Can I tell you that we have no spare time at all and loads of supplementary requests, so it would be good if people could be succinct with questions and answers. And first of all, we have health and sport. Question number 1, Sandra White.
Thank you very much, Presiding Officer. To ask the Scottish Government what action it is taking to address suicides.
Claire Hawkey.
Suicide prevention continues to be a priority for the Scottish Government. In our recently published Mental Health Transition and Recovery Plan, we set out an evidence-based suicide prevention response to the pandemic. In partnership with our National Suicide Prevention Leadership Group, we have recently launched an evidence-based campaign entitled United to Prevent Suicide. We continue to work with the NSPLG and stakeholders on suicide prevention, and this work is focused on examining differing models of suicidal crisis support, sharing best practice and restricting access to the most common means of suicide. This also includes taking forward the 4 priority actions for a pandemic-specific suicide prevention response, as recommended by the group in its COVID-19 statement. And these include work to improve real-time suicide and self-harm data in partnership with Public Health Scotland.
I thank the Minister for that reply, and the Minister will be aware that I have 3 universities and a number of FE colleges in my constituency, which host thousands of students. Can I therefore ask what increased mental health support is being offered to students in Glasgow Kelvin, and in light of indications which show worsening mental health in this age group, will people across my constituency and across Scotland and beyond continue to be able to access applied suicide intervention training to help prevent suicides?
Claire Hawkey.
Now more than ever, it's of the utmost importance that our students are able to receive the mental health and wellbeing support that they need, and we're actively considering what additional targeted support is needed for students to support their mental health and wellbeing. On the 22nd of September, the Scottish Founding Council announced a further £3.6 million in support of our commitment to provide more than 80 additional counsellors in colleges and universities in Scotland over the next 4 years. And this builds on last year's investment, and good progress has been made by institutions in putting these counsellors in place. We've also funded NUS Scotland to host Think Positive, Scotland's student mental health project, which supports students experiencing mental ill health, tackles stigma and discrimination, and promotes well-being in colleges and universities across Scotland. The Applied Suicide Intervention Skills Training Assist is currently not being delivered. This is because it cannot be carried out face-to-face due to COVID-19 restrictions. And to support the needs of the health and social care workforce during this period, pandemic-specific learning resources were developed by NHS Education for Scotland, and these resources give support in responding to people in distress and crisis, and on mental health and suicide prevention.
Can I just say, if members and ministers take so long just answering the one question, basically, we won't have time for supplementaries. Can I have a very quick supplementary, please, from Maurice Corrie?
Thank you, Deputy Presiding Officer. What discussions has the Minister had with veterans' organisation about suicide prevention amongst our veterans in Scotland?
Claire Hawkey.
The Scottish Government has ongoing discussions with all of our key stakeholders on a regular basis.
Thank you. That was rather good. But I suspect that Mr Corrie might be dropping you a line. Okay, question number 2, David Stewart.
Thank you, Presiding Officer. To ask the Scottish Government what advice, guidance and financial assistance has been provided to professional football clubs during the COVID-19 pandemic.
Joe Fitzpatrick.
We've been working closely with the football authorities from the outset of the pandemic to ensure all clubs at all levels have access to the support and advice that they need at this difficult time. A range of general financial assistance has already been made available by the Scottish Government and the UK Government, and many football clubs have accessed this funding. We're aware that this is extremely challenging times for football clubs in Scotland, particularly given their relative reliance on gate receipts compared to clubs elsewhere in the United Kingdom. Recognising this, today I wrote again to the UK Sports Minister seeking urgent clarity from the UK Government on the financial package being developed to support sporting organisations which are most affected by the delay of the return of spectators to stadia and the ban on consequential funding for Scotland as a result.
David Stewart.
Thank you, Presiding Officer. And could I refer members to my register of interests? Our professional football clubs facing a perfect storm, the loss of fans, the loss of matchday revenue and the rising compliance costs for COVID-19. Will the Minister look at setting up a specific football support fund as a matter of urgency? Clubs are not just businesses, they're the beating heart of the local communities. My plea to the Minister is support our local clubs or face a new year with the demise of much-loved community champions across Scotland.
Joe Fitzpatrick.
I recognise the member's particular interest in his region in football. As I said, we are trying to work with the UK Government to develop support. I had what I consider to be a positive meeting with the UK Sports Minister around this matter, particularly around sports where there is a large reliance on spectators, but thus far we haven't had the clarity that we would have hoped to have received to be able to develop support for teams in Scotland. We absolutely want to get supporters back as soon as possible, and the member will be aware that the First Minister last week announced limited numbers of supporters would be allowed in areas with level 0 and level 1 restriction, obviously important to the members' interests, and officials are working with the football authorities on the detailed arrangements for this with a view to supporters being back at some fixtures very soon.
Quick supplementaries, please. Kenneth Gibson.
Presiding Officer, can I ask the Minister what advice, guidance and financial support is being provided to amateur football clubs?
Joe Fitzpatrick.
So officials are working with football authorities and we are absolutely of the view that football at all levels needs to be supported by any scheme that is developed coming forward once we have that clarity around funding. And as I said, I've again written to the UK Government today stressing the particular importance to Scottish football that we do develop a scheme, and I'm absolutely acutely aware of the importance of the amateur game as part of Scotland's football offer.
Liam MacArthur.
Thanks, Deputy President Officer. The Minister will be aware from cross-party representations that the Highland League had hoped to start with spectators at the end of November. This has been thrown into doubt with 11 of the teams in Level 1 area, but 6 in Aberdeenshire in Level 2. Given the health and wellbeing benefits and the important role these games play within the respective local communities, what consideration is the Government giving to allow the League to resume as planned at the end of this month?
Joe Fitzpatrick, were you able to hear all that okay, Minister?
I think he was perhaps asking about the Highland League. Yeah, I certainly hope. Obviously, the Highland League took a decision to postpone the start of their season, and that was a decision for them. I'm hopeful that with the fact that the vast majority of the Highland League being in level 0 or level 1, that they will be able to move forward, and I'm keen that my officials engage directly with the Highland League. I think it's important that when we're talking about football, we don't just talk about the Premier League teams, and we consider the importance of football to communities right across Scotland and at all levels.
I have another 2 supplementaries. Please make them quick. Brian Whittle and then Gil Patterson.
Thank you, Deputy Presiding Officer. Given that so many sports have innovated and adapted to create COVID-safe environments, does the Minister agree with me that the response to COVID and the ability to play sport, especially outdoor, must be evidence-led? And will he work with me and others to make sure that happens?
Joe Fitzpatrick.
I think I've been hugely impressed with the efforts of a range of our sports governing bodies, not just football, in terms of how they've attempted to manage to continue to provide support to their players and sports people throughout the pandemic. Clearly, we have to be led in terms of clinical advice as to what is safe and what is not safe. We've taken some decisions around professional sports to allow greater exceptions to restrictions at that level, but particularly at levels 3 and level 4, where prevalence in the community is relatively high, we need to make sure that we're not doing something which inadvertently could lead to the virus being further spread. And that's particularly important around contact sports. And of course, when we're talking about contact sports, we're not necessarily meaning sports such as judo, where there's direct physical contact, but we're talking about sports where, in the normal course of a game or a match, people are within that 2 metres for a regular period of time. So that absolutely includes football.
Gil Patterson.
Thanks for presiding officer. Having met with Clydebank Football Club along with Martin Doherty Hughes, where the plight of the West of Scotland Football League clubs who are facing ruin because of the coronavirus restrictions was discussed, can the Minister comment on my written request to set up a hardship fund for clubs like Clydebank Football Club who do not qualify for any other financial support? And can he comment on my request to set up a pilot scheme into allowing a limited number of spectators to attend matches under COVID-19 guidelines, which would allow them to do so safely and perhaps, if successful, roll it out across that league?
Quickly, if you could, please, Minister.
So I apologise, I haven't yet seen the member's letter. Members will be aware that we are receiving a huge volume of correspondence, so I'm not able to respond directly to the member's points in his letter, but I'm hugely sympathetic to clubs like Clydebank, which are currently unable to welcome supporters back. Obviously, there was, I hope, a piece of hope at the end of the tunnel for supporters across Scotland when the First Minister announced that some supporters will be allowed back into areas which are in level 0 and level 1. Hopefully that will be an additional impetus for supporters to encourage everyone to follow the facts advice and try and help us all drive the level of the virus down. Obviously that's one reason, but for me, the main reason for us to drive the virus down has to be to save lives. In respect of the hardship fund, I think I mentioned earlier that I'm continuing to try to ask the UK Government to give us clarity on a fund which and what the Barnett consequentials would be for Scotland, so that we could develop a fund to support not just football but sport across Scotland.
Question number 3, Claire Adamson.
Thank you, Presiding Officer. To ask the Scottish Government how it is encouraging physical activity within the necessary measures to suppress COVID-19.
Jo Fitzpatrick.
We recognise the benefits that all sport and physical activity brings to physical and mental health, as well as the key role sports clubs play in local communities. That's why we are protecting the ability to undertake essential outdoor exercise in every tier of the strategic framework. Through the Clear Your Head campaign and working with Sport Scotland and other partners, we continue to encourage the public to remain physically active for the health and wellbeing benefits that it brings, and provide the advice and guidance to ensure that it's undertaken safely and in accordance with all national and sectoral guidance.
Claire Adamson.
Can I thank the Minister for his answer and his answer to the previous questions around football. We know that organised sports provide a great deal of physical and mental health benefits for participants, but a number of amateur football clubs in my constituency have raised concerns with the restrictions on their operations. Particular grievance is that the restrictions on grassroots football are not the same for junior football, and I would be very grateful if the Minister could outline the rationale behind this distinction.
Jo Fitzpatrick.
So clearly there is a risk of increased transmission with any contact sport at any level. Professional football, like other professional sports, have been given an exception, and around that there have been pretty strict guidelines that they're being asked to follow. So while we absolutely recognise the importance of organised sports, for organised contact sports there really is an increased risk of spreading the virus through that activity, that contact activity, and that's why we need to be as careful as we can We continue, and the First Minister made clear in Parliament last week that we continue to look to see if there can be further relaxations. I was very pleased over the weekend that we were able to make clear that the travel restriction around sport did not apply to 17-year-olds and unders. I think that's a really positive development. On all of these things, we are guided by the clinical advice, and the clinical advice for that particular group was particularly strong. So I was really pleased that we were able to win that argument, and I know that will make a difference to so many young people across Scotland.
Question number 4, Kenneth Gibbs.
Thank you, Presiding Officer. To ask the Scottish Government what steps it is taking to ensure that flu vaccines are available for those who need them.
Jean Freeman.
We have taken a number of steps, including procuring sufficient vaccine to cover all those eligible in this enhanced programme, which covers 2 million people, working directly with all health boards to improve delivery and deal with demand, including work on how vaccine supply can best be utilised, ensuring all board delivery plans reflect how they will respond to the high volume of calls, so that those who are currently eligible receive their vaccine as soon as possible. By the end of last week, just over 1 million people who are eligible for the vaccine had been vaccinated. That is 44% of the total number we aim to cover.
Kenneth Gibson.
I thank the Cabinet Secretary for that response. In my constituency in communities like Kilburnie and West Kilbride, vaccination has proceeded very smoothly, with constituents contacting me to praise the staff delivering the programme. However, in Arran and Largs, concerns have been raised about availability. Unfortunately, Ayrshire and Arran Health Board has been very slow to respond to those concerns. Can the Cabinet Secretary again chivvy the Health Board, I know she has already, to be both more proactive and responsive?
Jean Freeman.
I'm very happy to commit to doing that, Mr Gibson, as you would expect. I wrote earlier this week to the chairs of all our NHS boards, asking them to provide me with detail on how they brief our MSPs to ensure that that is happening, not just on the vaccination programme, but on COVID generally and on other issues, that is happening with regularity and properly, with full disclosure of information. I will pick up with them how they respond, how all the boards respond to individual MSP queries. They are not all as consistently good as I would wish. I'll particularly take that on with Ayrshire and Arran, and I should assure the member that I receive a daily issue log on the performance of the vaccine programme across all our boards and follow up where I think we are not moving fast enough.
Question number 5, Jeremy Balfour.
Thank you, Deputy Presiding Officer. To ask the Scottish Government when the First Minister first became aware of hospital patients who had tested positive for COVID-19 being discharged to care homes.
Jean Freeman.
As the First Minister said in her written reply to Mr Cameron, Donald Cameron, on the 14th of October, and I'm quoting, "I would confirm that prior to the Sunday Post publishing their FOI, neither Scottish ministers nor government officials had information on the results of COVID-19 tests prior to discharge or where these patients were discharged. The Cabinet Secretary commissioned Public Health Scotland to enable us to more fully and consistently understand how many people were assessed as being discharged with a recent positive test result and the rationales that were in place for such a discharge. As the member will know, guidance has been in place and has been updated since the 13th of March. The 13th of March guidance specifically refers to the need for clinical screening and risk assessment to take place of patients who are being discharged from hospital. That guidance, of course, as I've said, has evolved and been updated as our knowledge and understanding of the virus has developed.
Jeremy Balfour.
Can I thank the Cabinet Secretary for her answer? However, I still think there's still confusion over these times. The First Minister was asked about this subject on the 22nd of April at our daily briefing by Chris Mason of the Scottish Sun. So will the Cabinet Secretary correct the record and tell us whether ministers and their officials ignored the information provided back in April, or if they didn't, outline what action was taken at that time?
Jean Freeman.
I don't believe I have a record to correct. I've read out what the First Minister said in her letter to Mr Balfour's colleague. Mr Balfour will also know that I think it is on the 21st of April that I introduced guidance requiring ensuring that all those who were discharged to a care home were tested prior to that discharge, but that of course supplemented the guidance on the 13th of March that I referred to, and the subsequent guidance again from memory on the 26th of March. If I've got any of those dates wrong, I will of course correct them, but I don't believe there is any record to correct, as Mr Balfour asked me to do.
Supplementary from Monica Lennon.
Thank you, Presiding Officer. I wonder if the Cabinet Secretary read the article in the Sunday Mail on the 19th of April, which was about New Karen Court Care Home in Falkirk. The care home said that they were having to accept COVID patients. So I accept that the guidance changed on the 21st of April. Did that article or that information have any bearing on that? And can I ask for clarity on what the current testing policy is for people being admitted to care homes from other settings, not just hospitals?
Jane Freeman.
So, of course, ministers read, and I do, as best I can, all the media coverage that we see every day in terms of COVID in the widest possible sense. That's not possible to read everything, of course, and we are questioned on that both in this chamber and elsewhere. So it is fair to say there was a growing concern around whether or not clinical risk assessment, which was in there from the 13th of March guidance, was sufficient to ensure that we were taking all the steps necessary to protect both patients, but also where they were going to, remembering, of course, the majority of elderly patients discharged from hospital were discharged to home. And that all leads to, as well as developing clinical understanding, all leads to the initial testing guidance, if you like, requirement on the 21st of April that Ms Lennon refers to. The current position, of course, is, as she knows it, in terms of discharge from hospital to a care home where the patient has been in hospital for COVID-19, but also where the patient has not been in hospital for COVID-19. There still requires to be a negative test. From memory, 7 days before discharge. In terms of community admission to care homes, the requirement is for a negative test, where at all possible, 7 days before admission to the care home. If that is not possible, and the individual should be admitted to the care home within those 7 days, then on admission there certainly should be isolation in their own room until you've gone through that proper incubation period, if you like, after the test, and you've got the test results.
Short supplementary, please, from Neil Findlay.
I'm not asking about individual results. I'm not asking about when guidance changes. I'm asking a very straight question to the Cabinet Secretary. On which date, that's all I want in an answer, a date, did you know that COVID patients were being discharged to care homes untested?
Jane Freeman.
And I believe I've already answered that question, and the First Minister has answered that question. If Mr Findlay...
Mr Findlay, please stop shouting from the back row.
Thank you, Presiding Officer.
Mr Findlay, please stop shouting from the back row.
If Mr Findlay wishes me to go and look at when the Sunday Post published their FOI, then I'm very happy to do that. I'm sure he could do that himself. But if he's looking for a specific date, then that would be the date. Because, as I said, I would confirm that prior to the Sunday Post publishing their FOI, neither Scottish ministers nor government officials had information on the results of COVID-19 tests prior to discharge or where those patients were discharged. I don't think that can be any clearer. It's clearly not the answer Mr Findlay wants for whatever purposes he continues to pursue this, but that is the answer, that is accurate, and that is what I'm going to say on the matter.
Mr Findlay, please refrain from shouting from a seated position in the back row. Can we move on to question 6, please? James Kelly.
Thank you, Deputy Presiding Officer. To ask the Scottish Government whether it will review its decision and revisit the suspension of amateur outdoor sport, including football in the Central Belt, in light of the benefits that sport delivers.
Joe Fitzpatrick.
We recognise the benefits that all sport and physical activity brings to physical and mental health, as well as the key role sport clubs play in local communities. From the 2nd of November 2020, a revised approach to outbreak management based on 5 levels of protection was introduced as set out in the strategic framework document, with local authority areas in the Central Belt being placed into level 3 along with Dundee City. The coronavirus COVID-19 local protection level document provides the COVID protection level for each local authority area and information on what you can and cannot do at each level. In level 3 areas, organised contact sport can still take place for those aged 17 and under, and organised non-contact sport outdoors and organised exercise indoors and outdoors can be undertaken by those aged 18 and over. We recognise this will be disappointing for many adults who will not be able to play contact sport in level 3 areas, but the First Minister noted in the Scottish Parliament on the 29th of October 2020 that we will continue to review the situation around the sports restrictions and give updates as and when we are able to do so based on clinical advice.
James Kelly.
The Minister will be aware of how much stress and mental health is caused by the pandemic. And it was demonstrated when amateur football returned early in the summer that it was of great benefit to those participating in terms of relieving that stress and mental health. I've received a number of representations from well-run amateur football clubs, such as Rutherglen Glen Cairn under 21, making a strong case for the reversal
Could
of
you
this,
move on a
this
little
decision.
bit, please, Mr
Sure.
Kelly?
Can I therefore ask the Minister if he agrees that stress levels are helped by participation in sport, and on what basis a review of this decision will be set out?
Joe Fitzpatrick.
So I do agree with the bulk of what the member says. Football and all sports are really important, not just for our physical health, but also for our mental health and wider well-being. Really, really important. So it is not likely that the Scottish Government took the decision to not allow those contact sports in level 3 and level 4 areas, which is why the First Minister confirmed that we would continue to look at the evidence. The challenge is that these sports, these contact sports, are sports where the playing of the sport, irrespective of how well organised the sport, the club is, the playing of the sport is a huge risk to the spread of the virus.
Short supplementary, please, from Beatrice Wishart.
Thank you, Deputy Presiding Officer. I've been contacted by a local adult football team who question why they can't use a large indoor training facility, given the low COVID case numbers reported in the Isles and the difficulties of outdoor training in a Shetland winter on often waterlogged pitches. Will the Government look again at the Level 1 guidance on indoor contact sports?
Joe Fitzpatrick.
I'll be very brief, yes.
Oh, thank you for that. That allows question number 7 from Jackie Bailey.
Thank you very much, Presiding Officer. To ask the Scottish Government when NHS boards will be in a position to provide clinics that will specifically treat the long-term effects of COVID-19.
Jean Freeman.
We are actively supporting the Scottish Intercollegiate Guidelines Network, which is working with the National Institute of Health and Care Excellence and the Royal College of GPs to develop a rapid clinical guideline on the persistent effects of COVID-19, long COVID. This guideline, which is critical then to the development of services, is expected to be published before the end of this year. It will address a formal definition of the disease, how to identify ongoing symptoms, and a definition of best practice investigation and treatment options to support the management of the condition. Additionally, we have launched a call for applied research proposals designed to improve understanding of the longer-term effects of COVID-19 on the physical and mental health and well-being of people in Scotland. The research has the aim of developing effective clinical interventions. So, in summary, at the moment our NHS is working to treat individuals with particular symptoms along the lines of the respiratory and the heart work that is there and undertaken, but the work to create a clinical definition of long COVID is critical, and from that work we will then be able to cohort, if you like, the right kind of clinical services to address the needs of people who are experiencing long COVID symptoms.
Jackie Bailey.
Can I thank the Cabinet Secretary for her response? My constituent contacted COVID-19 in March. Since then, she's had to live with debilitating symptoms, including fatigue, breathlessness, headaches, sore eyes, blood pooling in lower extremities, tachycardia and much more besides. She's a nurse. She's tried to go back to work 3 times. People need one-stop clinics to deal with long COVID. England have already set them up, as I understand it. Please, when will this happen in Scotland?
Jean Freeman.
So I don't disagree at all with Ms Bailey, and I have huge sympathy for her constituent and for the many others who are suffering in this way. The range of symptoms that Ms Bailey has just read out could be added to by some of the additional symptoms that others are experiencing. And from there, I think you can see the real need for a clinical definition which guides clinicians on the various symptoms that an individual may present with, not to dismiss those as being about something else, but to investigate properly whether or not that is then long COVID and work out a treatment plan that can best treat the most critical symptoms first and then work your way through. So it's a long, long exercise. No great comfort to her constituent, I completely appreciate, but it is the right way to ensure that you have that holistic treatment approach. Now, as soon as we have the guideline, then we are ready to bring together, to cohort the necessary clinical input, it's not dissimilar from other conditions, to cohort the necessary input so that individuals can get that holistic diagnosis and treatment plan that begins to help them. I too have read that NHS England have set up those clinics. My understanding is no, what we have read is a news release about being about to set up those clinics. And we could have issued something similar, but I'd rather do it once we've done it than anticipate it in advance.
Question number 9, and I would appreciate brevity. Please, Gillian Martin.
Thank you, Presiding Officer. To ask the Scottish Government whether it would provide an update on antibody testing for COVID-19.
Jean Freeman.
So in Scotland, we are using antibody tests to improve our understanding of COVID-19 and in the clinical management of patients. Public Health Scotland, in partnership with boards, is leading national surveillance and research studies to utilise antibody testing. In addition, the Public Health Scotland Serology Surveillance Programme has collected 19,000 blood samples between the 9th of March and the 3rd of August, with reported estimates of antibody prevalence from this sample being in the region of 3 to 4%. Antibody testing is also underway as part of our enhanced surveillance in schools, with over 13,000 antibody tests already delivered. And the Siren study of COVID-19 immunity in healthcare workers has now started recruiting. 20% of participants of the ONS COVID-19 infection survey are being invited to provide samples for antibody testing.
Gillian Martin.
I thank the Cabinet Secretary. She's anticipated quite a lot of things on my supplementary. Just want to ask something simple. If at one point people who suspect they may have had COVID but did not get tested will be able to get an antibody test in the future?
Jean Freeman.
So that is entirely possible that it will do, as I'm sure the member understands. What is still not clear, which is why all this work is underway, including the research on a four-nation basis as well as the individual nations of the UK, it's still not clear if you do have antibodies, how long does that provide you with any protection against the virus, and what level of antibody presence do you need in order to give you any level of protection, as well as not knowing for how long. So all of that work is underway. But I know there are a number of individuals who believe they had and may well have had COVID-19 without being tested. And certainly as we understand the veracity and the validity of such tests for an individual, as opposed to increasing our understanding in our research work, then we would want to make those available to as wide a number of people as we had the capacity to do so.
Thank you. That concludes questions on health and sport. Now, I did let that run on a bit because of the number of supplementaries, etc. And I made a judgment which I hope is not too awry. But can I please ask for a bit more discipline in questions and answers in the next section? And we move on to communities and local government. I've grouped together questions 1, 7 and 8. So question number 1, Bill Kidd.
Thank you, Presiding Officer. With my to ask the Scottish Government, there's no point in asking the second question first, to ask the Scottish Government what progress it has made on its target to build 50,000 affordable houses during the current parliamentary session.
Kevin Stewart.
Thank you, Presiding Officer. The latest Scottish Government quarterly affordable housing supply statistics show that since the beginning of this parliamentary period, we have delivered 34,988 affordable homes, over 23,000 of which are for social rent. These are part of the 95,692 affordable homes delivered since 2007, over 66,196 of which were for social rent, including 14,393 council homes. Presiding Officer, as I stated in April, the impact of the lockdown means we will not meet our 50,000 affordable homes commitment by the end of March 2021. We remain committed to our target and are continuing to work closely with partners across the housing sector to deliver the remaining homes as quickly as it is safe to do so.
Bill Kidd.
Thank the Minister for that answer. With my Glasgow Anniesland constituency having such a large number of people in the over 60s age demographic, I was wondering if you could look a little into the figures and tell me what the impacts have been on the variety of housing options currently available for this age group through open market shared equity, help to buy, shared equity options, and not forgetting direct rental from local housing associations.
Kevin Stewart.
Thank you, Presiding Officer. The Government offers people aged 60 and over the opportunity to apply for our shared equity schemes as a priority access group with no requirement to take out a mortgage when purchasing a property. The Affordable Housing Supply Programme supports the delivery of flexible housing capable of being adapted to suit people's changing requirements, and wherever possible, all new build units are built to housing for varying needs standards. In the 4 years from April 2016, over 2,200 affordable homes were purpose-built for older people across Scotland, including over 450 in Glasgow. And we also recognise the value of people being able to adapt their existing homes to suit changing needs and to support independent living. And in the 4 years from April 2016, more than 4,500 adaptations were completed for housing association tenants in Glasgow.
Question number 7, Graham Simpson.
Thank you. To ask the Scottish Government what its position is on ensuring that planning authorities do not reduce efforts to deliver new homes and other sustainable development during the ongoing COVID-19 pandemic.
Kevin Stewart.
Presiding Officer, the Scottish Government has worked with planning authorities and stakeholders to ensure that the planning system remains open for business throughout the ongoing pandemic.
Graham Simpson.
Well, can I thank the Minister for that answer? The Scottish Government's consultation on Scottish planning policy and housing would delete the presumption in favour of sustainable development and weaken policy on planning for housing delivery, and there's a lot of concern around that. So can the Minister give assurances that Scottish planning policy on housing and wider sustainable development will not be changed if there's any risk at all of a reduction in the number of new homes receiving planning permission and being delivered in areas that have a housing shortfall?
Kevin Stewart.
Presiding Officer, as Mr Simpson is well aware, I want to see more homes across Scotland, but they have to be the right homes in the right places. That is key in terms of delivering for our people. In our consultation, we've proposed removing wording that specifically states that there is a presumption in favour of development that contributes to sustainable development. It is very clear that in practice, this statement means very different things to different people and is causing quite a bit of confusion, including in the courts. As matters stand, it's not necessary for the development first to be considered to be sustainable development before the presumption can apply. Can I say to Mr Simpson that we have consulted in this? We've received 244 responses to the consultation from a wide range of interests, and we're currently considering them in order to inform our next steps.
Question number, 8.
Thank you, Deputy Presiding Officer. To ask the Scottish Government how its planning policy supports the delivery of new housing developments.
Kevin Stewart.
Presiding Officer, our policies are clear that planning should have a sharp focus on the delivery of housing. Planning should maintain a generous supply of land for housing and support the delivery of homes through joint working. We are currently reviewing our planning policies and will publish an update on National Planning Framework 4 later this month.
Murdo Fraser.
Can I thank the Minister for his response? Like Mr Simpson, I've received representation from house builders in my constituency who are concerned about the proposed changes to planning policy and the impact this might have on the supply of available land to develop. Specifically, they've raised with me the watering down of the requirement on local authorities to maintain proper supplies of deliverable housing land. Can we have an assurance from the Minister that these concerns will be taken seriously when looking at the planning policy review?
Thank you, Presiding Officer. As I said to Mr Simpson, I want to see the right houses in the right places. And our proposals do not aim to reduce our support for the delivery of quality homes, but they do aim to clarify our existing policy ahead of the 4th National Planning Framework, which will be laid in draft in the Parliament for scrutiny and consultation in September 2021. I have to say, Presiding Officer, that I received communications from members across this chamber, I think, if I remember rightly, including from Mr Fraser over the course of this parliamentary term, around about getting the housing right and in the right places and ensuring that our planning is absolutely spot on and that there's a following of local planning policies. As I say, this will not reduce our support in terms of the delivery of homes across the country, but we must clarify exactly what the situation is.
Now, if supplementaries are very quick, I'll get them all in. Mark Ruskell.
Thanks. Numerous planning permissions for new housing developments in West Fife are being granted out with the local development plan by the reporter on the basis of a perceived housing shortfall. That the new spatial strategy of South East Scotland contains a housing land requirement for Fife, which is a third lower than the previous figures. So can I ask, has the Minister considered these revised figures, and can he confirm if the government reporter will now commit to upholding the democratically decided local development plan for Fife?
Presiding Officer, one of the reasons which we're carrying out this current consultation is because there is often an argument about numbers and about that presumption. I think that, as Mr Ruskell pointed out, there are some communities that feel that there is overdevelopment and, you know, I am keen to ensure that local development plans have the right housing numbers in them, as in the case of the new Planning Act, to get this right as we move forward. I want to see robust local development plans. I want to see robust regional spatial strategies, and National Planning Framework 4 has to be absolutely right. And I think that if we do all of that, then we iron out some of the difficulties that some communities feel that they are in.
I'm sorry, I can't take any more supplementaries in that one. Time doesn't allow. Question number 2, Fulton McGregor.
Thank you, Presiding Officer. To ask the Scottish Government what action it has taken to tackle food poverty during the COVID-19 pandemic.
Aileen Campbell.
The Scottish Government has invested more than £130 million to tackle food insecurity caused by the pandemic. This included providing free school meal provision over the summer. We've also recently announced we'll continue supporting free school meal provision in holiday periods up to and including Easter 2021, benefiting over 150,000 families. This is in addition to significantly increased investment in the Scottish Welfare Fund. This investment has enabled the public, the private and third sectors to work in partnership to ensure that everyone has access to food and other essentials. Founded on the principles of dignity and human rights, our cash-first approach is putting money in the pockets of those who need it, and we're committed to tackling the root causes of poverty.
Fulton McGregor.
I thank the Cabinet Secretary for that response. She'll be aware of the great work of many voluntary organisations in my constituency over the last 8 months who have been delivering food to our most vulnerable, and these include the Coatbridge Food Bank, the Stay Connected Project, Glenboyk Development Trust, Kirkshaw's Neighbourhood Centre and Lanarkshire Community Food, to name but only a few. As we move into the winter and this second spike in COVID cases and more subsequently more restrictions, these organisations are working around the clock, and I have noticed that again they're encountering a similar level of demand that they experienced at the start of lockdown. And I therefore ask what further supports will be made available to allow this crucial work to continue to deliver over the coming winter months.
Aileen Campbell.
Thank you. I pay tribute to the groups that Fulton McGregor has outlined, and all the community groups that are doing phenomenal work across the country. Fulton McGregor is correct to point out that this is a particularly challenging time coming into the colder, darker, more expensive months. So we have, out of the £350 million community package funding, we have committed over £15 million to support critical third sector and local community food responses through the Wellbeing and Supporting Communities Fund. And we've also got a £25 million community and third sector recovery programme that's supporting our third sector to continue to support people and communities in responding to the local ongoing pandemic. So we will continue to work with groups, we'll continue to work with local authorities as well, because this is an issue that's not going away, and we need to make sure that we do all we can to support this vital response.
Can I just say that questions are not for speeches on either side. Can we please cut down on the questions and answers? Question number 3, Emma Harper.
To ask the Scottish Government how the Scotland Loves Local campaign will support and encourage community shopping.
Aileen Campbell.
The Scotland Loves Local campaign is encouraging people through a range of media to safely support their local businesses, shopping locally and accessing local online offerings. The campaign builds on the community spirit and local support experienced at the height of the pandemic, with more people becoming aware of the community benefits of shopping locally. So I welcome the support that many of my colleagues across the Chamber have given to this campaign.
Emma Harper.
I thank the Cabinet Secretary for that answer. This is an exciting opportunity for local projects and local businesses such as Upper Sennick Farm in Dumfries and Galloway, and the businesses which support Dumfries farmers and farmers market and the town centre market. Can the Cabinet Secretary outline how those in my South Scotland region can apply for the fund?
Aileen Campbell.
The Scotland Loves Local Fund will provide grants of between £500 and £5,000 to develop projects that improve and promote their local place and communities, and application forms and guidance notes are on the Scotland's Towns Partnership website. So hopefully if her constituents go there, they can be directed to the right way to apply for this funding.
Question number 4, Alex Cole-Hamilton.
I've done this again. I'm sorry, Presiding Officer. I'm afraid I'm adrift of my question. If somebody's got to...
OK, we'll move on to question number 5. James Dodd.
Presiding Officer, I do apologise. To ask the Scottish Government what
Excuse me, Mr Cole-Hamilton.
Yeah.
We're now on question number 5.
OK, I apologise.
Question number 5, James Dornan.
Progress has been made in enabling the transfer of community assets on Community Empowerment Scotland Act 2015.
Aileen Campbell.
Thank you. Great progress has been made since the Asset Transfer Part 5 of the Community Empowerment Act 2015 came into force in 2017. To date, there have been 127 successful asset transfers requests made by communities. Community asset transfers include parks, woodlands, community growing spaces, sports and recreational facilities and community hubs.
James Dornan.
I thank the Minister for that answer, although you did cut out a wee bit just towards the end of it. I got the gist of it. I've been made aware that ALIOs are exempt from the Community Empowerment Act, therefore making it harder for community organisations to finalise asset transfers in a timely manner, if at all. Can I ask the Minister to look into this anomaly, as I have at least 2 organisations in my Glasgow Cathcart constituency waiting for a decision on an asset transfer which involves that organisation?
Aileen Campbell.
Thank you, and I thank James Dornan for raising this important issue. We are aware that local authorities, of course, use arm's length organisations and that can sometimes create confusion who owns or is in control of assets, and that's why we've pulled together a National Asset Transfer Action Group consisting of senior representatives from the authorities listed in the Community Empowerment Act and also partners and stakeholders in the sector. So we'll consider issues such as the ones that James Dornan has raised and provide direction on that.
Question number 6, and if he's quick, we can go back to Mr Cole-Hamilton.
Thank you very much. To ask the Scottish Government what steps it will take to raise public awareness of its plans to introduce new fire and smoke alarm standards.
Kevin Stewart.
Thank you, Presiding Officer. The Scottish Government, in recognition of the challenges posed by COVID-19, will seek parliamentary approval to delay the implementation of the new standards for fire and carbon monoxide detectors from February 2021 until February 2022. People need to know what the changes are, why they are important to ensure that homes are safe, and what action they need to take. We will continue to work with partners to spread awareness of the changes before the new deadline, if it is agreed by Parliament, and ensure timely, effective publicity takes place to ensure high levels of awareness and understanding. Our focus will be on supporting householders to ensure satisfactory fire and carbon monoxide alarms are installed so that we can improve safety in all homes.
Lewis MacDonald.
Thank the Minister. As well as making sure that people are aware of the new deadline, will he also ensure that householders are clear about precisely what actions the legislation will and will not require them to take?
Kevin Stewart.
Absolutely, Presiding Officer. The legislation was highlighted in the media at the very beginning. Our intention had been to ramp up publicity as we came closer to the date. We have had help from the Scottish Fire and Rescue Service in all of this, who have been given advice about the right equipment that is required as well. I am more than happy, Presiding Officer, to send further communication to all members around about the right equipment that's required so that they can pass that on to their constituents.
We'll go back to question number 4. If you could be quick, please. Alex Cole-Hamilton.
Thank you for bringing me back in, Presiding Officer, to ask the Scottish Government what discussions it is having with local authorities regarding the safe reopening of local services, including libraries.
Aileen Campbell.
The Scottish Government is working closely with local government, predominantly through COSLA and Solace, to understand how best we can support them and identify priority areas that may require support during this challenging period. We've produced safer workplaces guidance for public libraries to help local authorities reopen public libraries safely, and work with a range of partners in producing this guidance, including organisations representing the sector and local authorities. The guidance, first published on the 14th of July, is updated regularly in response to feedback from partners. The decision to when to open libraries is for the individual local authorities.
Alex Cole-Hamilton.
I'm very grateful for that reply. Everybody in this chamber will recognise the importance of libraries, community libraries, to community cohesion and well-being. And while some libraries in my constituency have safely reopened, like Kirkliston, Drumbray Library and Blackhall Library remain shut, and that is because of an insufficiency of capacity in cleaning services to meet COVID-19 restrictions. So what additional support can the Scottish Government offer local authorities to bolster cleaning capacity in this pandemic?
Aileen Campbell.
Well, on issues beyond just the simple reopening of libraries that I outlined, of course, we engage with local authorities on a range of issues and have provided support both in kind and financially to local authorities to respond to the pandemic. Of course, we continue, like I say, to update the guidance that's there to enable the reopening of libraries safely, because I absolutely understand the point that Alex Cole-Hamilton is making. These are critical services for people. They provide a place to go, a space to be, and also access to computers often as well. So it's incredibly important, given all the restrictions that are placed on people's lives at the moment, that we have these spaces. And if there are more and further things that Alex Cole-Hamilton would like to raise with me for me to further pursue, then I'm happy to do so, because I think, I don't think there's any disagreement in recognising how important these facilities are.
That concludes questions on communities and local government. We'll move on to the next item of business.